The island recorded 2 alleged suicides in a matter of a week, leaving many to speculate on the state of mental health assistance on island. News Force touched base with psychiatrist at the Tapio Hospital, Dr. Julius Gillard, who examined the suicide statistics of the island. He attributes a drop in suicide awareness campaigns as a factor that may have led to a slight uptick in recent times.
2017 it went up to 12. I think 2018 it went down to 3, and that was because we were doing a lot of sensitization with regards to the helpline and suicide awareness. I think that year you all were probably seeing me too much. And the year after, it went up again, that's 2019, because I took a step back and nothing was done.
The psychiatrist highlights the bigger issue at hand remains the mental health system on island.
I cannot tell you what is attributing to what's causing the increased rate. What I can tell you is that there is not enough mental health awareness being done in St. Lucia. There are not enough mental health services being provided to the citizens of the country.
The ongoing financial crisis wrought by COVID-19 is also being cited as a possible factor which has compounded the mental health state of some. But according to the expert, suicide is a very complex and deep-seated issue which cannot be blamed on one variable.
A lot of persons are going through a lot of financial difficulties, and that with that comes other difficulties. So comes relationship difficulties coping with other stressors that they're going through. So one of the problems that persons have is that they have a lot of stressors, and so that makes it a lot more difficult to manage their emotions. And the result is them lashing out. So lashing out with regards to impulsive behaviors. So we've seen an increase in crime, and we're also seeing an increase in suicide. So I strongly believe that the two go hand in hand, that they are due mainly to persons not knowing how to manage their emotional distress.
Dr. Gillard notes that suicidal thoughts act with no prejudice, and anyone who does not manage their mental health adequately can be affected. Given the prevalence among men, all 7 suspected suicides for 2020 were males. Dr. Gillard calls for a revitalization of support groups like clubs, churches, and organizations.
How many mental health support groups do we have in St. Lucia? 1, 2. How many men's support groups do we have in St. Lucia? 1 or 2. So we as a society as well need to support each other, try to work out. I know there are churches who have men's groups, but then other persons, so different clubs and so on, football club, whoever. How do they support their members' mental health? They go out and they train and so on, yes, but one of the members is going through something. What happens? They teased and they say, oh, your woman leave you or whatever, but how do they support their members to ensure that they remain safe if they're having suicidal thoughts, to ensure that they don't commit an act, a criminal act, if they're having thoughts of killing somebody else, or they have thoughts of having some kind of grudge towards somebody else. All of those things need to be looked at, and we as a society need to take our mental health a lot more seriously than we are.
The psychiatrist is urging society to break the stigma attached to depression, stress, and anxiety, and seek professional help to reduce the prevalence of suicide. If you or someone you know is suffering with depression or harboring thoughts of suicide, you can call the 24-hour helpline at 203 for assistance. The hotline is confidential and callers remain anonymous. The national helpline 203 is toll-free for both Digicel and Flow carriers. Solange Alfred, HTS News Force.